Good afternoon to all of you. I am Rajiv from General Healthcare. Am I audible? Yes, sir. I am Rajiv from General Healthcare, and I have my colleague with me. He is Mr. Dr. Tom, who is from Medmark Corporation USA, which holds majority stake in General Healthcare. And we are here specifically for an objective to really understand what kind of trainings you go under and what kind of trainings you feel can help you more. Like there will be certain syllabus, what your course you would be in. So you may be doing GNM, ANM or BSc or MSc, whichever course. Now in addition to that, what kind of courses you feel are going to help you. Now all of you know that all your courses are governed by Nursing Council of India. So you really can't go beyond, like college really can't go beyond talking about any specific subject which does not allow them to go beyond the borders of Nursing Council of India. So they really need, their hands are tied for that specific reason. But yes, there will be certain gaps which you all may be feeling that it would be really helpful. That if you get some course which would be say 50 hours course. When I say 50 hours, it may be something like a week's course. So 8 hours, 5 days a week, so 40 to 50 hours course we are talking about. If we get you certain these kind of courses and if they are made available here, then we would like to know what kind of your takeaways for this. Like what would you be interested in these kind of courses and what kind of tie-ups we can have. We are trying to work that out as well. So I would request Dr. Tom to give you some background about what we are trying to do or what we are thinking actually to do. So he would give you more details.
Good afternoon. Congratulations. I believe many of you are going to graduate soon. Is that right?
Yes, sir.
Congratulations. Can you understand me okay?
Yes, sir.
Okay. I'll speak slowly. I'm an American doctor. I'm a general physician, but I also have a technology degree, so I work in health informatics and computers in healthcare. Midmark is a company based in the United States that is involved in all the healthcare systems. Mayo Clinic, Cleveland Clinic, the Boston hospitals, and we have access to some of the high-end healthcare services that are there and some of the programs the American nurses are using to educate themselves and be more expert in their fields. So Midmark, being a partner of JANAC, we feel we can perhaps help JANAC develop programs that can make your training even more special. So if you want to learn more about intensive care medicine, pediatric medicine, infection control, behavioral health, we feel we can come and bring some of these resources to you that would give you a little better chance to demonstrate to the top tier hospitals that you are a qualified candidate, that you have special skills above and beyond the next nursing candidate. This also might give you an opportunity to show that you are capable, perhaps working somewhere else, in a far off thoughts, perhaps even internationally. So we'd love to hear your feedback on if you feel those programs are something you would find value, the way you'd be willing to commit the time and maybe a little bit of your own money to make that happen for your own career. So I'm going to pass the baton back to Rajiv and we'll take it from there. So thank you.
Thank you, Dr. Tom. So we would like to hear from all of you. So you may get some online certifications which would add value to your current courses, as well as that can give you opportunities for working abroad as well. And whether all of you like it or not, but we know for sure that every nurse destination finally would be US, Europe or Middle East, or that kind of opportunities nurses would always look at. Because when we sell our furniture and we go to hospitals, my colleague Sunil would keep doing a lot of trainings about how to use the bed. And he does this training in the month of May, and when he goes to in the month of July, he sees all different faces. And he would go and talk to head of the department, and the HOD would say, all my nurses have changed. And where did they go? They have gone abroad. So we know this situation for sure. And I'm sure all of you also have certain goals and objectives in your life, and going abroad. I'm not saying something bad. It is absolutely good and it is good for your own career. So we would like to know what kind of courses you would be interested in. So I would request the field is open, then you can tell me what kind of things you're looking at.
Give some ideas. What sort of food you want?
You can talk anything rubbish under the sun, it's fine.
What sort of field, what sort of courses you want? What sort of
Which all courses have been provided from your institute that we can avail?
Excellent. Now this is the classic question we get when we ask what you want. And generally this is the question which comes up, but we are trying to find out that there will be certain modules which would be available, with certain universities. And there will be certain modules which can be developed. So you may have certain modules which are already present in universities, and we may have certain modules which can be customized as well. But obviously, customization happens only if you have volumes. Like customization won't happen for 5 or 10 candidates. The customization would happen if there are certain minimum numbers depending on every university's policy. So we will try to work around that. But we would like to know from you what you want, because I can say there is everything available. Then how do you choose out of it? Because that is what is the major question. So we would like to know that somebody may say, okay, we really want to be trained in infection control, for example. We really want to be a tissue viability nurse, for example. Now, I don't know whether you know what is tissue viability nurse, but I hope you know. Somebody may say that I want to be specifically community health nurse. So we are looking out for that kind of feedback from you, so that when we go back, we can actually talk to universities to find out whether we have something ready-made available or we need something to be customized. So I would request all of you not to repeat the same question as I said, because we have everything. Now you tell me what you want.
I think most of us will go for ICU trainings.
Okay, so
maybe
you feel
infection control. Yes.
infection control.
Yes, sir.
Okay, so you feel ICU training would really help you, and it would add value to you whatever degree or diploma you'll be getting. Okay. Any other course you think of? Oncology specialty. Okay. So you want to manage onco surgery patients, or how it is like?
So when we are dealing with the patient of oncology and giving them medicines, like we have to take some care by giving them medicines, no? So that I'm telling.
Chemotherapy is
Okay. Excellent. Anyone else? The critical care is the one which you are looking at. The oncology nursing which you are, looking at. What else?
the OT specialty. OT.
Okay. So operation theatre specialty nursing, right? So somebody would like to go in for OT kind of setup. Fine. Excellent. Any other inputs? No, are you going to give me the branches now? Med-surg, OBG, OT. I'm sure all these are modules which are covered already, right? I would like to know one thing from you, what kind of non-clinical courses you are interested in. How many of you want to be leader in your life? Would you like to lead any team, or would you like to work as a team member? So do you think you have sufficient skills to lead a team? You do have? I'm not asking professors here. I'm asking students. Do you think leadership skills would help you as a training program? Would you be ready to shell out money for that?
Whether these courses will be recognized in these training
You don't even like to answer?
It's very important that the quality of coursework that we provide you is of the top quality. So we don't have a certification program that we have created yet, but the thought is we would bring perhaps an American university's content and say this is a program from the Mayo Clinic, or this is a program from Vanderbilt, or one of the better medical schools in the U.S. So the certificate might have value just because of the fact that you've completed an American level course, and that if you were to approach a hospital, that carries some weight with it. So we would be excited to approach those institutions and say, could we develop specific Indian programs to bring you to a new level? So if you were to look for an abroad job, you say, I have these 10 certificates that I've taken from institutions that you all respect and admire.
Because it should meet with our Indian standards also. Like, definitely we are looking for the abroad standards, but it should equally be applicable in our system.
If not more applicable for India, absolutely. We know that it has to have value to you, that when you show it to somebody, they say, oh boy, this is important. And it can't be just a piece of paper, and it can't just be for the good of learning. It has to be something you use as a tool to get you a better paying, higher level job. Yeah, the whole focus is to bring you the ability to be a better candidate at a higher pay with higher skills. That's the whole point. And learning for the sake of learning is great, but it's certainly not the focus.
So how much credit will be giving when all of the students will be
How much credits?
how much credit hours?
See, these nitty-gritties we are trying to work out. We have not really worked them out. We are trying to find out whether we can run these courses parallel to your last semester, so that you are not burdened much. At the same time, you don't have to spend some time again after you finish your course, because I'm sure all of you would be like to work immediately after you graduate. So we don't want to, take another 2 months away from you, saying that now you do this course and then get the job. It is like telling you that you work without 2 months salary if you don't want to. So we would like to run these courses as possible as parallel to your last semester. Second thing is, you are all GNM students, right? Yes. You are all BSc students. Yes. So generally you would get placed in which kind of hospitals after you graduate from here? Great. So you will be getting into Max, Apollos, Fortis of the world, right? And your next destination is definitely abroad. Because these are the premier institutions we are talking about in India, beyond which there is nothing which exists, unless somebody wants to get into AIMS and have a 9 to 5 or 8 to 4 kind of great job, then that's fine. But otherwise you would be, talking about going abroad, because you are already BSc. How many of you would be interested in going ahead for post-graduation? So you are sufficiently creating the replacements for you all. That's great. Excellent. So we are talking about, if I can sum it up, we are talking about intensive care nursing, we are talking about oncology nursing, we are talking about the OT specialty nursing. We'll have to find out. Not really found out. Yeah, we have not really found out about psychiatric nursing. You have we'll have to find out. Sure. We'll find that out. We have not really looked at it, because most of the places where we have visited, we have found that ICU, infection control, and OT has come up as a regular thing. And one of the additional thing which has come up here is oncology nursing, which is great. So what we are going to do now is we are going to go back and do this exercise on drawing board and try to find out that what kind of thing we can do it, what kind of thing we can present to you, what would be the duration, what would be the investment from your end required, and then we'll be in touch with Mr. Jain to find out how we can deliver it to you. So thank you very much for spending your time and giving your valuable inputs.
I also want to tell you I'm very impressed. We had a nice tour of the Institute, and your learning facilities are all new. You have new equipment. You have great simulated models for doing some of the procedures. You should be very proud of the school you're graduating from, and very appreciative of your teachers and leaders here, because they're really, from what my take from it, are very much out for your best interest. So congratulations.
Sir, one query I got. You were saying that these courses will be conducted simultaneously during the last semester. So they have got a limited syllabus available from the university. They can't go beyond that. isn't it? So they can only concentrate on their own studies, through which they will be passing out the examination, getting the marks.
Yeah,
But they will not be able to concentrate on the other course which you are telling them.
Yeah, but you could be having certain, what you call internship in the hospital.
This is a practical difficulty, I'm telling you.
There have been two subjects, one is director, one is communication. That, they are getting the experience.
So what I feel-
Other papers, research project.
You have to involve in such a way.
Internship, no, we don't, internship as such a way, even they are having the internship also, and they are, that time, 6 months, they are having the different, hospital. These people, they don't.
We'll have to find something.
Yes, we will have to do a separate way.
But Indian Nursing Council, they have started the paid specialty. It is already, it is there, existing 1 year course. Various courses are there. Now we need to talk about that. Those courses can be started, because I know, because I was in RIT now. So twice one of the institutions they started critical care nursing. So that, I think 20 batches they came, 120 students batch. And after that, nobody came. One of the private institutions, very good hospitals, that is the Noida hospital, they started that, they advertise, they spend around 1 lakh or more than that. Nobody went to that, They said, you come, hospital said, we'll give you the study leave everything. But nurses say, that just I am telling you that, nurses say, what is the harm to go that 1 year course? Because you won't get any extra benefit, that is monetary benefit or something. So from that level up.
Everything premium costs money, then you have to keep in mind. And whatever best we can give at best possible price, we'll try to do that. That is for sure.
One thing more, sir, you should also explore possibility with them just to raise them abroad. You should like to explore all these possibilities.
That obviously no nursing institution also promises. So
No, you will
even I will not promise.
No, it is not a promise, but you can certainly have to say that we
We can definitely do that because once we have the attachment with certain hospitals abroad, obviously we can tell them there is a demand
Yes, yes.
at one end, there is a supply at other end, we can always
Definitely,
this is something is happening.
They will be having an upper hand after doing that module.
Students are not wrong, but simply saying that they should be given some sort of help and also, but so it should be well for them. That will be really a good incentive for them. Just why they want to do it. Certain things you say they are already doing in the BSc, I think nobody will prefer to repeat the same. Even if you tell here,
But then
nobody will do like
sitting in nursing institution and sitting in front of respected madam and sitting in front of all respected professors, when we talk to our customers who are hospitals and when we have a very good relationship with nursing directors and down the line people because we deal in air mattresses, we deal in hospital beds, which basically which is a product which is used by nurses. And when we talk to them and where we have very good relationship, they do talk to us about their pain points also. And when they talk about their pain points, they say, I have to say this, but they say no BSc nurse is ready for a job when it comes to ICU kind of job. And when they say that, they are saying that we need to invest a lot of executive or senior nurses' time to really shadow them and make them ICU ready. So we are trying to tell them that we will give you somebody like you all who would be trained for ICU nursing, oncology nursing or OT nursing, where you don't need to spend your time and you don't need to shadow them, and which they appreciate. So to answer sir's question, that is how we can place you. When I say that I can't give you guarantee, but I can definitely try to help you because I can tell you that so and so gentleman has passed this specific course and he or she would be eligible for getting into ICU directly. Which otherwise your path would be what? You would be getting into a basic nursing in hospital. You would be in wards first, and then gradually you would be graduating to ICU, right? Or kind of theatre requirement. So you don't go on day one, right? So we are trying to bridge that gap.
Okay, maybe online they can understand that all this theory. But there should be some hours, like 40 hours or something, the practical. That
Yes,
should
there
be
is.
also.
See, as I said, we are absolutely open to do that,
That to be-
provided people should be able to invest time. Not only money, it's time as well.
Time is also, no, 1 week for that no problem.
Because if you are going to say that I'm going to see that document and I need practical experience, sorry, it's not possible.